Hey everyone, Gabby here from Bootcamp.com, and for today's video we'll be talking about the nerves that are found in the infratemporal fossa. So the main nerve of the infratemporal fossa is our cranial nerve V3, also known as our mandibular branch off of our trigeminal nerve. Now the mandibular nerve is going to have some sensory and motor functions. It's going to give off some nerves that are going to go supply sensory innervation to the areas of the temples, along the areas of the jaw, as well as the areas of the chin. It's also going to supply sensory innervation to the areas of the parotid gland via our radiculotemporal nerve, and also going to apply general sensory innervation to the areas of the tongue via our lingual nerve here in orange. We'll also see some sensory innervation from our buccal branch or our long buccal nerve that will be supplying sensory innervation to the mucosa in the skin of the cheek. And then we'll also see our inferior alveolar here in pink that will then go and supply sensory innervation to the areas of the teeth that are found within the mandible. We also have some motor fibers that are going to go to supply motor innervation to our muscles of mastication that act on our temporomandibular joint to allow us to move our mandible or to chew our food. And those can include the deep temporal nerves here, the anterior and posterior, that are going to go and supply the temporalis muscle, as well as the masseteric nerve here that will go and supply the masseter muscle as well, both of them being muscles of mastication. We will also see two very small branches that will be going to the lateral and medial pterygoids in order to supply them with motor innervation. So now let's talk about these branches individually and talk about the areas that they supply. So one of the first branches coming off the mandibular nerve is going to be our auriculotemporal, and the auriculotemporal is going to be traveling more posteriorly after it gets off of that mandibular nerve. And we can see here and here how the auriculotemporal gives off two roots that form this space. So those two roots separate and they eventually converge together. But when they separate, they form this space in which the middle meningeal artery here can pass through. And the middle meningeal artery is a branch off of our maxillary artery, which is the main artery of the IT fossa. So the mandibular nerve is the main nerve of the IT fossa, and the maxillary artery is the main artery of the IT fossa. So that middle meningeal artery will pass through those auriculotemporal roots, eventually ascend to pass through the foramen spinosum to enter into the areas of the skull, to enter the areas of the brain in order to supply the cranial cavity. Now, as far as the auriculotemporal nerve, it has a couple different functions. There are going to be some general sensory branches that will go along the anterior aspects of the ear, as well as branches that will go along the areas of the temples that will travel with the superficial temporal artery. We'll also see a few other branches that will be traveling to the face in order to supply the parotid gland. So the parotid gland is one of our salivary glands that sits just anterior to our ear. It is very superficial. So that auriculotemporal is going to give off some fibers that will go and supply general sensory to that parotid gland. Now, since the auriculotemporal nerve is already going to the parotid gland to supply it with general sensory, the parasympathetic innervation, or the fibers that are going to the parotid gland to supply with parasympathetic innervation, might as well just travel with that auriculotemporal nerve. So remember, the parasympathetics are a bit lazy and they hitch a ride for the most part with the nerves that are already going to the areas that they need to innervate. So the auriculotemporal nerve specifically is going to be carrying the postganglionic parasympathetic fibers to the parotid gland to allow the parotid gland to produce saliva. Now, the preganglionic parasympathetic fibers will be coming from the lesser petrosal nerve, which is a branch off of our cranial nerve 9, also known as our glossopharyngeal. So those preganglionic parasympathetic fibers will synapse in the otic ganglion, which you will be able to see within the IT fossa. So once those fibers synapse, then those postganglionic fibers can then travel with that auriculotemporal nerve to the parotid gland. Moving on to the branches here that are traveling more inferior along the IT fossa, the first one we're going to have more posteriorly is going to be the inferior alveolar nerve. And the inferior alveolar nerve is going to travel inferior to then enter into the mandibular foramen here along the mandible. So the mandibular foramen is a hole on the posterior aspect of the mandible where the inferior alveolar artery and nerve can pass through in order to enter the mandibular canal in this region. So they're going to enter within the bone itself. And then as it's traveling through the mandible, it's going to give off some sensory fibers or nerves that will go and supply sensory innervation to the teeth that are found within the mandible. But before the inferior alveolar nerve travels through the mandibular canal and through the mandibular foramen, it's going to give off a small branch here called the nerve to mylohyoid. And the nerve to mylohyoid is a motor branch that will supply motor innervation to the mylohyoid muscle as well as the anterior belly of the digastric, which are two muscles that are found along these regions of the neck. So as the mandibular nerve passes through that mandibular canal, gives off those branches to supply sensory to the teeth, it will then pop out here of the mental foramen to give off the mental nerve. And the mental nerve will supply sensory innervation to the areas of the chin. Next, we have the long buccal nerve here in blue that will be supplying sensory innervation to the areas of the mucosa and the skin of the cheek. So it's going to be traveling more superficially along the IT fossa to eventually get to the areas of the cheek. Now I want you to pause for a second and think what muscle provides motor innervation to our buccinator muscle. And I'll give you a hint, it is not going to be our long buccal branch or our buccal nerve from the mandibular branch. So pause the video and think for a second. So remember that the buccinator muscle is a muscle of facial expression, so it's going to receive innervation from the facial nerve, and more specifically, it's going to be the buccal branch of the facial nerve that will be supplying motor innervation to the buccinator. So make sure you don't confuse the two. The buccal branch of the facial nerve is motor, whereas the buccal branch from the mandibular nerve is going to be sensory to the cheeks. So between our inferior alveolar and our long buccal nerve or our buccal nerve, we're going to find our lingual nerve. And as the name implies, this lingual nerve is going to be traveling to the tongue. And as it travels to the tongue, it's going to give off branches that are going to go ahead to supply general sensory to the anterior two-thirds of the tongue. Now, the lingual nerve is a bit special because it has some connections with our facial nerve, but more specifically via the chorda tympani nerve. And the chorda tympani is a branch off the facial nerve, and we can see that chorda tympani, which is right here, joining together with the facial nerve in order to get to the tongue. So the chorda tympani needs to get to the tongue because the chorda tympani is going to carry the special sensory fibers that will go and innervate the anterior two-thirds of the tongue with taste. It's also going to carry some parasympathetic fibers that will then synapse in the submandibular ganglion that will then provide parasympathetic innervation to the submandibular and sublingual glands. Moving on to a few branches that are coming off more superiorly. So here we have the deep temporal nerve. So we're going to have a couple that are going to be posterior, and we're also going to have a few that are going to be anterior. And these nerves are going to be found deep to the temporalis muscle. So here's a temporalis muscle. So those nerves are going to be found deep to the temporalis, in between the temporalis muscle as well as the skull. So that would be the skull. So since these nerves are found deep the temporalis muscle, they're going to go ahead to supply the temporalis muscle with motor innervation. And the temporalis muscle is one of our muscles of mastication that sit along the lateral sides of the head here and act along the temporomandibular joint. We also have another branch that's going to go and supply motor innervation to another one of our muscles of mastication, and that's going to be our masseter. And our masseter muscle really sits along the ramus of the mandible. And this masseteric nerve will also be a bit more superficial, but will be traveling deep within the masseter muscle to eventually give off a few muscular branches to go and innervate it. It's also going to give off some sensory innervation to the temporomandibular joint, which should be located in this area over here. Lastly, we have the lateral and medial pterygoid nerves here that are very, very small branches that are going to be coming off that mandibular nerve to go and innervate the medial and lateral pterygoid muscles, which are also two other muscles of mastication. So those muscles specifically, though, are found in the IT fossa. So those branches are very, very small and very, very short because those muscles are kind of already there. They don't have a long pathway to take. So because these nerves are so small, it may be difficult to see them in a cadaveric dissection. So now let's look at what these nerves look like in a cadaveric dissection. So I mentioned that the infratemporal fossa, so the main nerve of the infratemporal fossa is going to be the mandibular branch off the trigeminal nerve or cranial nerve V3, but we also have our maxillary artery here, which will be the artery that provides the main supply. So if you look at some of the branches of the mandibular nerve, we're also going to see the deep temporal posterior nerves and the anterior deep temporal nerves that will be traveling deep to the temporalis muscle. So here the temporalis muscle has been reflected, and we're looking at the skull here, so we can see how those deep temporal nerves are deep to the temporalis. And they are going to be traveling with the deep posterior and deep anterior temporal arteries. We can also see more inferiorly here is the otic ganglion, and that's where those preganglionic parasympathetic fibers from the lesser petrosal are going to synapse, and then eventually those fibers will then be carried with the auriculotemporal nerve to the parotid gland. Looking at some of our branches that are more inferiorly here, we can see our inferior alveolar nerve, that is going to be one of the more posterior ones that will give off the nerve to mylohyoid. We can then see the lingual nerve that comes in here with the chorda tympani. So again, that chorda tympani is going to merge with the lingual nerve in order to get to the oral cavity to supply the areas of the tongue, as well as the sublingual and submandibular glands. And then the branch that is more anterior here is going to be the buccal nerve. And remember, the buccal nerve is purely sensory, or the long buccal nerve, and is going to supply sensory innervation to the skin of the cheek. It is not going to supply motor innervation to the buccinator muscle, which is one of our muscles of facial expression. Alright, so let's see what you've learned today. So label the following nerves and which one is a branch off the facial nerve. So pause the video and then come on back when you're ready. Alright, coming off our mandibular nerve here, we have two small branches that will go and innervate our lateral and medial pterygoid. So those are going to be our medial and lateral pterygoid nerves. Again, very, very small nerves that can be difficult to see when you're doing a dissection. We also have the auriculotemporal nerve here that we said gives off those two different roots that will separate to allow for this middle meningeal artery to pass through. And we said the auriculotemporal infratemporal was going to go and supply sensory innervation to the areas of the ear, the temple, as well as the parotid gland. We also have the inferior alveolar nerve here, which is going to be traveling within the mandible to supply sensory innervation to the inferior teeth, and that before it travels within the mandible, it's going to give off the nerve to mylohyoid that will go and supply motor innervation to our mylohyoid muscle and our anterior belly, the digastric. Moving slightly more anteriorly along the IT fossa, we're then going to see the lingual nerve here that will be traveling to the tongue to supply the anterior thirds of the tongue with general sensory. We also said that the lingual nerve is a bit special because it connects here with the chorda tympani. So remember, the chorda tympani is a branch off of our facial nerve, so the chorda tympani swoops in and joins in with the lingual nerve in order to get to the tongue. So the parasympathetics are lazy, so they need a little bit of help, and that chorda tympani is going to be that branch off of the facial nerve and will be supplying the tongue with special sensory, or supplying the anterior thirds of the tongue with special sensory taste, and will also be carrying some parasympathetic fibers that will go ahead to innervate the sublingual and the submandibular glands. And then lastly, we had the buccal nerve here, or the long buccal nerve coming off mandibular, that will go and supply sensory innervation to the skin and the mucosa of the cheek, and not to be confused with the buccal branch of the facial nerve, which is a motor nerve that will supply motor innervation to our buccal muscle here. And here are the references for the images that I used today, and I hope you enjoyed this lesson on the nerves of the infratemporal fossa. Please let us know if you have any questions.